The vision of the Logan County Health District is champions of an informed, healthy community. Health districts were formed in the 1920s after, sorry Ben, but after some poor decisions by politicians about the 1918-1919 pandemic. So they were formed by the legislation. Still today, we investigate over 200 infectious diseases. You might recall SARS. We thought we had the first case in Ohio. Monkeypox, H1N1, tuberculosis, measles, mumps, a lot of recently with the Amish going to various places to do missions. Whooping cough every year, Ebola. Basically all this is unfunded. Try to think of health district as population health, so it's not individual one-to-one. It's to try to keep the community safe. We have a much expanded role today, of course, from the 1920s. Still close to 40 programs. I think we had 48 before we lost the levy. Food, think of restaurants, drinking water, sewage, 160 animal bites, investigations a year, mold, radon, home sewage. 600 nuisances a year. Some of these are funded through fees, usually not completely, and many of them are, such as nuisance investigations, or etc., unfunded. Basically, if you eat, if you live, you drink water, you buy food in Logan County, we touch you in some way. We used to say you only know you need us, when there's an epidemic or something. A number of years ago, there was an outbreak of Norwalk virus at a delicatessen, 139 people sick, and including the mayor at the time, in a hospital with that. And those are the kind of things we try to prevent and we investigate. The Ohio Revised Code set up in the 1920s says that you may have a city and a county health district, or you can have them together. And if there's not a levy, inside millage is used. To be honest with you, coming from Canada, I didn't even know what a levy was, because the government taxes everybody 50% and they kind of do more things. Basically, that money comes to us before it ever goes to your political jurisdiction. So next year that's 600,000, 119,000, the city of Bellefontaine when we get to 650. Jefferson Township 32,000, Stokes 94, Russell's Point 18,000. It's awful. I hate taking this money, but that's what happens when you don't have a levy. Including, we used to have 9 public health nurses. Sydney has 10. We now have 3, including a nursing director. And so we let go or stop the positions in the schools, but the schools had to hire nurses at more expense than we were paying. So sometimes it's like the Fram oil filter, you pay me now, you pay me later. And by the way, for your vote, for a point A mill levy, November 3rd, it takes us back to about what we were getting, well, a little more, but close to the 870,000 we were getting in 2008, sorry, we lost the levy. That's $28 per 100,000 valuation. Then all of the 600,000, and we promised this, we would not take any inside millage, would go back to your particular jurisdiction so they can fix roads and plow and whatever. By the way, Union County gets $1,650,000 from their levy. So we do touch you in other ways. One of our nurses was making a welcome home baby visit, which is another one of our programs, a couple of years ago. And she thought this baby wasn't breathing well. She listened to it, although the baby had seen their pediatrician, and heard a murmur, and got the child transferred to Nationwide, and that baby was operated on as an emergency and is alive today. We're telling the story of Summer because her mom said, I want people to know that population health sometimes is personal. And she came in for immunization, actually not that long ago, and the nurse thought she had a tremor, and her mom says, yeah, nobody's saying about that. And the nurse had her, got an appointment at Nationwide, and she ended up with a brain cyst that was operated on, and she's doing well now. So anyway, some people say, well, what are you gonna do with the money besides trying to keep your programs going? You know, we were involved with a hospital and the community health assessment, community health improvement plan, which also many other organizations were, but we spearheaded it with the hospital. Everything that came out of that, for those of you who talked about it, 4 things. One of them was drugs. It was all about education and trying to get people more informed about chronic disease. And we need to do accreditation. Sometimes when I was involved in the hospital, accreditation got kind of onerous after a while, but there is a new public health accreditation system. And if you don't have that by 2018, you lose access to all federal and state grants, which is $350 to $450 to $500,000 for us, hopefully more if we could afford a part-time grant administrator. So we just ask for your support. We're not perfect. We try our best to do things and try to learn from them, but we have great employees.